How do speech pathologists diagnose articulation? Have you ever wondered how speech pathologists figure out if someone has trouble pronouncing words? Diagnosing articulation is a detailed process that involves several steps. Let's break it down. First, speech pathologists start by gathering case history. This means they ask questions about the individual's communication background. Understanding past experiences can provide important context. Next, they conduct a speech sound assessment. This includes standardized testing, which helps evaluate how well someone pronounces consonants and vowels. These tests compare the person's speech to age-appropriate norms. This comparison helps identify any deviations that may indicate an articulation disorder. One common tool used is the Goldman-Fristoe Test of Articulation. This test measures how well someone articulates consonants in different positions within words. The results give objective data that helps determine if there is a problem. In addition to standardized tests, speech pathologists also use informal assessments. These can include conversational speech sampling, where they listen to how a person speaks in everyday situations. Picture naming tasks and story retelling are also helpful. These methods show how articulation issues affect daily communication. A key part of the diagnosis is phonetic transcription. Here, the speech pathologist uses the International Phonetic Alphabet to write down how sounds are produced. This documentation helps identify specific error patterns. For example, they look for substitutions, where one sound is replaced with another, or omissions, where sounds are left out. Recognizing these patterns is important. It helps differentiate between articulation disorders and phonological disorders, which involve rule-based sound patterns. Speech perception abilities are also assessed. This checks if the individual can hear and distinguish sounds correctly. Good perception is essential for accurate production. For those with severe speech difficulties, alternative strategies are used to gather information about their speech sound system. Finally, the diagnosis is finalized by combining all assessment data. This includes standardized test scores, observational findings, and analyses of speech sounds. This thorough evaluation guides the creation of a targeted treatment plan. The goal is to improve speech clarity and communication effectiveness. In essence, diagnosing articulation is a comprehensive process. It combines testing, observations, and detailed analyses to ensure accurate identification and effective intervention.